Pads. Same thing. I don't want to be back here on the neck. I want to be more medial where the larynx is and grab hold like that. And again, I have a very poor handle on the larynx itself when I use my fingertips. But I'm stretching the skin, and if this feels impactful for Barbara, then that's meaningful. I feel personally like I can get a better hold on the larynx by coming in, trapping it from behind, and pulling forward like that. While I say you press medially or inward, it's almost no pressure at all. Would you agree, Barb?
Yes.
Yeah.
So on a scale of 10?
What do you think?
I mean, there's just contact and direction, but
Yeah.
no.
Άρα είναι ελάχιστη η πίεση, δηλαδή από το 1 μέχρι το 10 ούτε καν, δηλαδή ίσα 1.
It's a 1.
Ένα λέει, επαφή και λίγο βαρύτητα προς τα κάτω, δεν πιέζει προς τα κάτω.
I just gently press to midline, and then we head down like that. Can you describe that feeling?
Yeah, it feels literally like someone is holding my larynx back.
Got it. Do you want to translate while you're
Ναι,
so we don't?
το αναφέρω τις περιπτώσεις που νιώθω άσχετα με τη χρήση της φωνής μου, στιγμές που νιώθω κυριολεκτικά σαν κάποιος να μου κρατάει το λαιμό και να με σφίγγει από πίσω.
I love the way she just described it. It feels like someone's pulling my larynx back. Because simplistically, it's exactly what we're trying to address by having our fingers in here, and I'm going to use words very loosely, trying to create more space.
Τον ενδιέφερε λοιπόν από
So I want to get my fingers right behind it, like that. Now, would you agree I'm pretty gentle right now?
Very, είναι
Yeah.
πολύ ελαφριά η αφή του μάμου.
And then I'm going to hold my fingers there while we turn Elpida's head the other way, and boop, there it comes out. I rest my fingers there, and I bring your head back to the middle.
Είναι πολύ απαλή το άκρη του άκρου.
And I think most people find this easier than the way I used to teach it for some of you, where I came under both sides at once. All right. The last one, the manipulation of or the gentle manipulation of the cricothyroid, which in your case
Πάει
is
τώρα
right
στην
there.
κρικοθυροειδική μεμβράνη.
And if you would, just give me an upward and downward pitch glide. So there's a little bit of a distraction here because the larynx is rising too while that space is gapping and then closing with up and down. So thyroid cartilage right there. And I'm taking my hand. I wish I could show you this and my hand was see-through, but I can't. I'm taking my hand and I'm trying to find a little bit of a handle so then I can move the entire larynx forward. You just hold it. Finally, we've got the combination of my lateralization and traditional laryngeal manipulation. But instead of how I have experienced laryngeal manipulation in the past, where they grab hold of the thyroid cartilage and they do a lot of lateralization, in what feels borderline threatening to me, I start to tend very soft, very soft and very slowly. I don't try to take that cartilage to full end range in both directions. We start with just a little bit of movement. And then I want to gauge from the patient, what do you feel? Does it feel safe? Does it feel good? Do you want me to go faster and farther? Or do you want me to go slower and don't go so far?
Is that comfortable?
Mm-hmm.
Okay. Okay. Guide me. Okay. All right.
Itchy?
Yes, it does.
Yeah.
When a patient says, "What is that? What's going on?" and they expect some kind of etiology, physiology explanation.
Something smart instead of just what I give, right? What I would say, ask the question again though. You're a patient. What would be your question?
What's happening? What is that?
What is what?
That feeling that I have in my belly. And it's
Yeah,
that
you mean
knot.
right there? What's that
Yeah.
feeling? Well, there's cartilage there, there's rib there, the diaphragm attaches in there, there's a lot of nerves in there. Notice what I did, I just threw a lot of possible anatomy things at you. And what I'll tell you then is it could be tightness within those muscles right there, whether it's the surface muscles or deeper in the diaphragm. It could be the nerves are irritated and creating that sense of discomfort or distress, right? Could be the cartilage is just a little funky. Could be a lot of things.
I find that a lot of patients, they're looking for answers.
They want
because
answers.
their doctors aren't giving them
Yep.
the answers. And they expect the therapist to give them
Absolutely.
the answer.
Yep. So make it your practice to always give them 2,
Yep.
right? Or at least 2. So
Right.
at least you can show, and you back each one up with a real smart sort of rationale.
But I do give possibility.
But trying to use these parts of my thumbs right in here, getting in with that flat space to compress and then drag downward. And we could make it a totally passive stretch, or we could make it active. Swallow, voice, tongue movements, whatever, jaw open, close, whatever the issue is, like get him into function right here. I want to make sure I'm not choking.
Nope.
I want to make sure you don't feel too much pressure or anything weird in your head, do you? No. I'm covering the carotids here, so I want to be careful. But I've got my pressure spread really broadly versus real focally, like when we do our fingers on the one we did earlier today with the retrolaryngeal. Is there anything about this that feels like we're doing something?
Yeah, I would say, like,
Stop that.
take care of the knot.
I'll change that behavior.
Take care of the knot and I'll stop it.
Right there?
Like, a little bit more, yeah, right there.
Right there?
Yeah, I don't know if you can kind of feel it with like your thumb.
No. But does it feel like I'm on it?
Yeah, maybe even a little more inferiorly.
Your patients don't know their anatomy, but they know what they feel. And that's what I try and get them in touch with.